Hi, everyone. My name is Jessalynn Adam, and I'm a sports medicine trained PM&R physician. I'm here to talk to you today about common running injuries and some ways that perhaps we can avoid them. This is a topic I'm really passionate about. I'm a runner myself, and unfortunately, over the years, I've suffered my fair share of injuries between this and my past sports, gymnastics, and dance. So I thought I'd start by giving you a little bit of background. Running is a great sport, so let's start there. And my goal is, if you ever have to see me, I won't tell you need to stop running unless you really need to stop running. So running is great exercise, even if you do it slow. I think running really is for everybody. But I will say that nearly half of folks who run, which is about 40 million of us each year, will experience pain or some kind of injury. Typically, this is going to be of the lower extremity, so the knee, the foot, or the ankle, or the shin. And most of the time, so about 80% of cases, are due to overuse. But that's actually a really good thing because that means that we can prevent this kind of injury. So a couple of things I'd like to highlight in terms of common injuries. A lot of what I see is knee pain, or the dreaded runner's knee, which is something called patellofemoral pain. And this is an overuse injury that can occur in up to about 30% of women who run and up to about a quarter of men. So I would also mention that also foot and ankle injuries. So if you're someone that likes to go off-road and run on trails, be wary of spraining your ankle and things like that. Then you've also got shin splints, Achilles tendinosis, and hamstring tendon injuries. So I thought I'd stop there and open things up for questions.
Sure. So if everybody can please make sure that you post your questions in the chat as you have them. So the first question is, what shoes are best? What types of things should I be looking for in my running shoes?
Sure, this is a question I get asked a lot, and not to be glib, but the ones that are most comfortable. So what I mean by that is there are a lot of shoes out there, and feet come in all different shapes and sizes. And so you really want to make sure that the shoe is comfortable for you. The folks at the running stores know a lot about shoes and what differs between each models. So they're a great resource. You can talk to them if you've got a favorite model of shoe, but there's a new version of it out. They can tell you if it's been overhauled or if it's more or less the same. But at the end of the day, if the shoe is not comfortable, it's not for you.
Should I stretch before I run?
This is another great question. So I'm sure if you ever attended gym class in school growing up, first thing you did was stretch, and typically what we call static stretching, which is where you sit and then you reach for your toes and things like that. And then you hold the stretch. This traditional static stretching really does not have any benefit for runners. And if you're doing shorter distances and sprinting and need power, it can actually be detrimental because a stretched out, lengthened muscle is not going to be able to contract effectively. And how should you warm up? I prefer a 10-minute warm up that is active. Now you might do some dynamic stretches if you prefer that, and that helps you feel the range of motion. But the goal is really not to stretch out the muscles, but rather to warm them up. And often you can do this by just starting out with your first 1 or 2 miles running easy. The important thing is you're really not fully warmed up until you're breaking a sweat. So it probably takes about 10 minutes or so to be fully warmed up, and that is really important to reducing injury risk.
Thank you. Question here from a 59-year-old female runner. She has run for many years. How does she know the difference between an injury and arthritis?
So sometimes you might need an X-ray to determine that. That's great that she's been running for many years. My goal is to make sure that she can run for many more. And that brings me to another misconception. Running does not make your arthritis worse. running actually reduces arthritis-related pain. And there's even some data that suggests that runners have thicker cartilage than non-runners. Now, at the extreme of anything, it is probably not good for us. So if you're running on average more than 40 miles a week over long periods of time, this can accelerate joint breakdown and wear and tear. So you can keep on running. It's not going to make things worse. Even if there is some arthritis, then it shouldn't hold you back. And there are certainly treatments for arthritis that I'd be happy to discuss in more detail.
Can I keep running if I have a tibial stress fracture?
I wish I could say otherwise, but this is one of those that you really can't. So a stress fracture is the end of the spectrum of an overuse injury. So many of us have experienced shin splints. And so this is some soreness along the shins after you run. That comes from the muscles tugging on the bone as you run and creating some irritation. If you ignore that, or you run too much too fast, then you set yourself up for an imbalance of the bone turnover. So basically, just like you wouldn't do 2 leg days back to back because those muscles need to recover and repair, the bones are constantly turning over. Fortunately, that doesn't mean you're getting taller every day, but your bone is a living, evolving structure. And so if you upset that balance and suddenly you have a lot more breakdown and the repair kept up, then you develop a stress fracture. And this is one of those things that rest, not weight bearing on it, and time are the treatments. If you continue to run on it, you risk converting a stress fracture, which is in the soft part inside the bone, to a complete fracture. And obviously that would require more invasive treatment and likely surgery.
Thank you. If I can't run because I'm recovering from an injury, can I walk or bike or swim? What else can I do?
It depends a little bit on the injury, but oftentimes, yes, I prescribe a lot of cross training for my athletes. I think it's very important for you to use your muscles in a different way. They learn certain patterns. And so if you can disrupt that pattern, they get stronger. Aqua jogging is a great one. So I use that a lot for runners that like to get in the pool. And it really builds strength and can actually make you a better runner. So I've had runners who are managing injuries and then come back even stronger than they were prior to injury.
How long after recovering from an ankle sprain do I have to wait to start running again?
I don't like time-based criteria. I think everybody's body recovers differently. So I use criteria. So the first thing is, do you still have a lot of swelling? Is it painful to do everyday life? Can you walk around and those sorts of things? If both of those have resolved and you have full range of motion, equal power, and no pain with light impact, then I think you're ready to begin running. And that's actually something I'd really like to highlight. So when you're coming back or even starting a running program, you really can't build too slowly. So there's this 10% rule that kind of floats around the running community of, well, how much can you increase from week to week? And it's a good tool, but to be honest, there really isn't a ton of evidence to back it up. So I would just say there's no change that's too gradual. So, and it differs person to person. Some people may be able to progress a little more quickly, whereas others can't. The other thing is you never want to change multiple variables at once. So if you're increasing your volume and running further, then focus on that. If you're increasing your speed, then you can increase the speed, but combining the two, you do set yourself up for injury. So go very, very slow anytime you're making a change to your training. That is by far the most common reason that people wind up in my office, is doing too much too quickly.
Thank you. So does that mean that tracking my runs is important, or can I just go out and run and I don't need to use an app or anything?
That's a good question. So I think tracking your runs is very helpful. The caveat I would say is it can be tempting to get, especially with these Strava segments and routes and Garmin devices and all sorts of Apple watches, you can track just about everything. So you also shouldn't be captive by your data, and you should do what feels good. But I do think having a sense of how much you're doing and how often is really important, especially if you do get injured, because you can look back on that and see, was there something that changed that precipitated that injury? So what I like to do is I like to keep a record, and then I listen to my body. If I didn't sleep well that night, then maybe I don't run as fast or I don't run as far. If I didn't eat well and I just kind of run out of steam, learning to say, okay, well, that's what I can handle today, will keep you in good shape and ideally injury-free.
Is it harmful to walk with weights wrapped around my legs? And adding to that, what about holding weights in my hands?
So I think I would question what you're trying to accomplish with that. There are other ways to build strength in running, and I typically don't advise that. I would rather you spend time doing dedicated strength exercises, and there are specific regimens that I like for runners. I have a circuit that I give to people regularly, targeting strengthening the hip abductors, so the ones that bring your legs out, and also the ones that externally rotate your legs. These are really important to protecting you from things like Itvan syndrome and trochanteric bursitis of the hip. So strengthening the hips, the core, all the way down to the ankles is really important. And a good test to see where you're at is, one, can you stand on one leg and balance? If you notice that your trunk is swinging all over the place, or that your hips aren't level, then we can do some work there. And if you can manage that just fine, then can you do a single leg squat? And can you control your knee? So if you watch yourself in the mirror, does it wiggle? Do you lose your balance? If you can do one, that's great. But something like running, you're doing that consecutively for 30 minutes, an hour or more at a time. And so those small muscles can fatigue. So that's a roundabout answer perhaps, but I guess I would say I focus on strengthening, and then I focus on the walking and running as its own form of exercise.
Thank you. Someone says, my hip is sore and has a big bruise after a fall a couple of weeks ago. Are there exercises to help strengthen the hip, or should they talk to a physical therapist?
So I think this is one where I'd want to evaluate this person on an individual basis. It just depends really what's going on there.
Thank you. When should I come see you instead of my primary care doctor?
Sure. You can come see me anytime. I'm happy to talk all things running, walking, sport related. Any injury. Often I really love to see people when they're not injured too. So if you have questions about how to do this safely, or you think that you might benefit from some physical therapy, then I'm happy to see you. And that's actually ideal, because then we can together work on preventing injury as opposed to playing catch up and trying to get you recovered. That's actually one of the biggest risk factors for having an injury while running, is having had a prior one. So if you have had a previous injury, definitely come in and see me, and we can try to keep you injury free going forward.
Thank you. Someone says, I keep hearing about stretching my IT band after running, but I don't really understand what that means. Can you explain?
That's great. You don't have to understand what that means, because you don't need to do it. So it's a misconception that the IT band needs to be stretched. Most of the times it does not. We used to call this IT band friction syndrome. And what that means is, so you have this fan-shaped muscle that has this fancy Latin name called the TFL, or tensor fasciae lata. And then it turns to this fibrous band that crosses over the outside of your hips at the widest point, and then extends all the way down the leg to the top of your tibia, actually. And there are a couple of points along the way where people get compression, not friction related pain. One is at the lateral hip. So this is the hip bursitis that people get. And then one is down right at the, if you've ever seen a dog bone, those bumpy ends at the end. So the very end of your femur. And so this is pain on the outside of the knee. And then also where it attaches on the tibia. So when you have lateral knee pain, this is often Itvan related. And what happens is if you go back to my single leg squat, if your hips drop, and so if these are your hips, if one drops off center like that, then all of a sudden you've put a lot of tension along that IT band. So most of the time it's not truly an IT band stretching issue and it being too tight. It's more that the muscles that hold your pelvis level, those hip muscles that I was mentioning before, need to be stronger. And I would say in almost any runner, you won't go wrong by strengthening those muscles.
Thank you. At what age can you start running if you're not terribly fit?
Any. I think running really can be for anyone. The important thing is to do it safely. And I really believe that it needs to be customized to your activity level. And so in your current fitness. But absolutely, I think anyone can start running and reap the health benefits.
Someone asked a pretty open-ended question. Can you talk about runner's knee?
Sure, there's lots to unpack here. So runner's knee is a little bit of a grab bag. Typically, it refers to patellofemoral pain. So for years, we would tell people that you needed to strengthen this muscle called your VMO. And I'm going to sound like a broken record here because really what the current evidence shows is that you should really be strengthening your hips. It does help to strengthen the leg too and the quads and hamstrings, but I believe that it's really important, something like running, that you strengthen everything. You can't really treat one problem in isolation. So what is patellofemoral pain? Your knee has three components. So you have your femur, your thigh bone, your tibia, which is your shin bone, and then your patella, which is your kneecap. So your patella is connected to the tibia by your patellar tendon, or patellar ligament is actually the correct term, and then your quadriceps tendon. So it's floating, and what keeps it in place in this little groove. So if you look at my hand here, if this is your kneecap, it kind of sits in a little groove. And so when you bend and straighten the knee, it lifts up and down out of the groove. So when you're doing something like running, that's lots of repetitions of the kneecap coming unseated and then sitting back down in the groove. If you have muscle imbalances, if you're a little tight in some muscles, weak in those hip muscles, then what happens is the kneecap can start to slide back and forth in that groove. And you get these shear forces across the backside of the kneecap and the femur. And the knee does not like that. And sometimes if it shifts enough, you'll even feel kind of clicking and popping. And people say, well, my knees pop and click when I go up or down stairs. And that's that kneecap shifting back and forth. So generally, some physical therapy is what will fix this, and some strengthening exercises to keep that kneecap controlled in the center. Sometimes I use bracing or taping techniques as well. But this is a really common one it's actually the most common overuse injury of the musculoskeletal system in active adults. So it's a big one.
Thank you. Do you have thoughts on heavy weightlifting with running? How do you build overall body strength, but stay loose enough for running, especially distance running? So how many days a week to lift versus run?
This is a great question. So I've seen many runners that running is all they do. And yes, to get better at running, you have to run. But I think the stronger that you are, the better runner that you will be. Now, this needs to be personalized for each person as far as how much you want to do and how frequent and what the weights are and the reps and all of that. But in general, especially leading up to a race, you're going to want to reduce that and focus more on running. When you're not leading up to a race and building mileage, especially for distance runners, then incorporating weightlifting or strength training on days when you're not doing is important. So I wouldn't with weightlifting. If you're doing something short, then you could combine them or dedicate separate days. The other thing is, for runners in particular, there are ways to build strength outside of the gym. So sprints, hills, those sorts of things also build muscular strength and endurance. And they can be a nice tool to complement your running. So I like to make sure that all of my runners have a strength training program that really targets the hips and the core, the quads, hamstrings. I really like single leg exercises over bilateral, especially for runners. This way, your dominant side can't cheat and take over for your weaker side. And oftentimes it allows you to accomplish the same goals with less weight. So this can reduce other injury, such as back-related injuries if you're doing deadlifts and things like that.
And we do have somebody in the comments who is saying that the root cause of most of their injuries for 40 years running has been glute weakness, and just agreeing with you that core strength is essential.
I would just tell them you're not alone.
The next question is, what suggestions do you have for runners about 25 miles a week with chronically very tight calves? They do a lot of stretching already.
I would incorporate some, well, let me back up. So I think we would need to evaluate why that is. There are a few different reasons that runners can have tight muscles. Sometimes certain people just have tighter muscles than others, men typically more than women. Some of it can be due to how you land. So if you're a forefoot striker versus if you land on your heel first. And then there are other reasons too. So there are more rare things, you know, like muscular dystrophies and things like that, or neurological reasons for tight muscles, or things like compartment syndrome. So those are probably not likely, but I think it's important for this person to have an evaluation to figure out the root cause. And then if it is just muscular, then incorporating something like eccentric exercises. So I actually prefer exercise as a way to gain muscle lengthening. Stretching doesn't often accomplish that. The one form of stretching that does is something called Pnf Stretching, which is basically where you trick the muscle into relaxing. So you do a series of firing the muscle and then stretching it and holding that position, and then you fire it again. And that's something that can be done with a physical therapist. And then the other way is to use exercise like an eccentric exercise. So if you've ever done a negative at the gym, you know, where you do a pull-up and then you go down really, really slow, what you're causing the muscle to do is contract and lengthen at the same time. So this is a really effective strengthening tool. You have to be careful with it just because eccentric contractions are often how we get injured. So if you think of a sprinter that gets a hamstring injury, it's a rapid eccentric contraction as their leg is stretching forward and their hamstring is lengthening. But in a controlled setting, it can be really valuable to lengthen that muscle. So it's a long answer to say, I think that they should have an evaluation. And if it is muscular, then maybe doing some eccentrics and Pnf stretching.
Thank you. I have crunchy sounding knees when I run. Am I hurting my knees? It doesn't hurt, but I can hear it. No, so this is often very, very unsettling to people. We call this crepitus. It kind of sounds like the bubble wrap, if you've ever popped the bubbles on the bubble wrap. And it just has to do with the joint mobilizing. Sometimes people can have full sound effects and something to address. Bothering this person, then I think they're fine to run. They may want to have an evaluation to see if they have any muscular weakness or anything that could be optimized to make sure they don't develop an injury. But no, you shouldn't feel that you can't run just because your knees make sounds. Thank you. So someone asks, what would you suggest if you were told you had perinatal tendonitis 4 years ago and you think it is flaring up now, but you're not sure because the pain seems to be more on the outer bottom side of the foot? Should they come see someone like you or a foot and ankle surgeon or a podiatrist? What would the next step be?
I'd be happy to see them. We could certainly take a look. That's one of the areas where the peroneal tendons insert. And so it's possible it's related to that. I always also want to make sure that there's no sign of a stress injury or a stress fracture as well. So yeah, absolutely. I think that's a perfect indication for a sports medicine doctor. Oh, I think you're muted.
Thank you. It did not unmute. Is there any truth that running on pavement is better than the sidewalk for impact and shock absorption?
Oh, that's a great topic for discussion. So running surface is really important. If you run on a track or the road, there's a couple things to note. So if you run on a track, typically you're running and you're turning and leaning the same way each time. So make sure however many times you go one direction that you reverse it. You don't want to develop muscle imbalances or stress one side more than the other. The same is true with the road. So the road has something called camber, and this is so that when it rains, the rain runs off to the side. So the road is actually a little bit slanted. It's usually subtle, but it's enough. Running is one of those things. It's like if you had a tiny pebble in your shoe and you only had to go a block, it'd be fine. But if you have to run 5 miles with that little pebble in your shoe, it's going to tear your foot up pretty good. So same thing here. Those subtle, small changes can really cause problems if you don't address them. So I always tell people, if you're going to run on the road, just make sure that you turn around, you come back on the same side safely, of course, to balance that out. As far as the running surface, there is some research that says that running on concrete could be a little bit worse and cause you to be more prone to injury. But there's a lot of conflicting data on some of that. The ideal surface is probably like a hard packed dirt or gravel. But with those, then you also have to watch out for ankle injuries. So I think I would say, if concrete is all you have, then that's fine. If you can safely run on a paved surface or gravel or dirt, then that's probably optimal.
Okay, well, thank you, Dr. Adam, and thank you everybody who has sent in questions. If you want to leave any other questions that you have in the chat, we will give them to Dr. Adam after this and reply to you in the comments. Dr. Adam, would you like to finish?
Sure. Thanks so much for tuning in. It's been a pleasure to talk to you guys about running, and I'm located at our Alexandria and Springfield offices. So if you do want to meet me in person, I'd be happy to meet and talk with you, and happy and safe running.